Congratulations! If you're watching this, you've got a carpal tunnel syndrome C&P exam coming up. That's a big step, and I'm here to walk you through what to expect and how to make sure your voice is truly heard. First off, your disability rating isn't just about what's written on paper. It's about how your symptoms and their impact on your daily life are understood by the examiner. You'll be asked questions like, when did your symptoms start? What makes them worse? And have you tried anything to treat it? Surgery, splints, medication? Be ready to talk about how carpal tunnel affects your work, your hobbies, even simple things like buttoning a shirt or picking up a cup of coffee. Your rating for carpal tunnel syndrome gets coded under paralysis of the median nerve, or diagnostic code 8515. Here's the breakdown. If your condition is mild, you're typically rated at 10%. Moderate symptoms can bump that up to 20 or 30%. If it's severe, you're looking at 40% or even higher, with the maximum rating at 70%. So, how do they figure this out? The examiner will check your grip and pinch strength. That means squeezing and pinching with your hand. They'll test the sensation in your fingers and hand, sometimes using a monofilament or a tuning fork. Expect some range of motion tests for your wrist and fingers, and yes, they might tap over your median nerve at the wrist to see if it causes tingling. There's also the Phalen's test, where you flex your wrist to see if symptoms show up, plus checks for muscle atrophy in your hand. Sometimes you might have had an EMG or nerve conduction study to confirm the diagnosis and see how bad the nerve damage is. Here's my biggest tip. Be honest about your symptoms and flare-ups. Don't tough it out or downplay your pain. If something hurts, say so. If you're not having a flare-up during the exam, let them know how often you do and how intense it gets. Don't push yourself to perform movements that you know will cause pain. The goal is accuracy, not heroics. Remember, it's your body. No one knows it better than you. If you ever feel like you're not being treated fairly during your exam, don't hesitate to reach out to your local VA and file a report. The bottom line, advocate for yourself. You served, so you deserve to have your experience heard and respected. Good luck. You've got this.